Well, ladies and gentlemen, if you feel ready, I will start my presentation. I would like to start by thanking the society, the president, the organizers, and the chair of the society. My name is Oraj Dikmen, and I'm the medical director for GE Healthcare Contrast Media Products in Middle East and Africa. Today I will be presenting about VisiPack and demonstrate how it protects your patients from different types of damage to the kidneys and the heart. I will start by the evolution of contrast media, because contrast media has evolved throughout the years since the products were introduced into the market in the 50s. So the basic information or the basic message is that ionicity and osmolality are the two factors that create the unwanted adverse reactions following contrast administration. And as I said, since the 1950s, from the introduction of ionic high osmolar contrast media products, there has been a move towards removing the ionic side chains and reducing the osmolality of the contrast media that are used in clinical practice. This was achieved by removing the ionic side chains and then reducing the osmolality of contrast media from high osmolar monomeric products to low osmolar monomeric products. And then in the 1990s came the introduction of non-ionic dimeric contrast media that I will be covering today. So since 1990s, iodixanol VisiPack, or iodixanol, which is the active ingredient of VisiPack, has been the only isoosmolar contrast media to be available on the market globally. So as a reminder, high osmolar contrast media are 5 to 8 times higher than blood's osmolality. That is why there was a shift in the 80s towards the low osmolars that are widely used, but the naming low osmolar can be misleading, because low osmolars, despite their name, are still 2 to 3 times higher in osmolality compared to blood's osmolality. So when you use low osmolars, you are still at risk of endangering your patient's well-being. And iodixanol VisiPack is the only product that is equal to blood's osmolality in both clinically applicable concentrations. It is isoosmolar both for the 270 and 320 concentrations. Why is osmolality a problem for us? Because once you inject any pharmaceutical product that has higher osmolality compared to blood's osmolality, there are reactions in the physiology of your patient. First of all, the body tries to balance out the osmolar load by moving free water from one compartment to the other. One of these compartments is the extravascular compartment. The other one is the intracellular compartment. So let's start with the intracellular compartment. The intracellular compartment, which is going to lose its water, will be the erythrocytes, and this will transform the erythrocytes into echinocytes. And once that happens, the erythrocytes will lose their morphology and their plasticity and will no longer be able to squeeze through the capillary, and that will lead to capillary deoxygenation. The second compartment is the extravascular space. With the shift from extravascular to intravascular, this will create a volume overload for the cardiovascular system. Third problem is that for this fluid shift to happen, you will have to disrupt the endothelial lining, and this will lead to disruption of the endothelial barrier, disruption of the endothelial cells that regulate vascular tonus, and of course this fenestration will create areas that are devoid of the endothelial membrane, which can lead to blood clots and aggregation of the clotting system, basically. So all these lead to the complications that end up with problems with the vascular pumping mechanism, cellular hypoxia, and blood clots that are endangering our patients. So as an example of the morphology loss of erythrocytes, this is a graph that shows that a big majority of red blood cells lose their morphology when incubated with iodinated contrast media, as opposed to the leftmost slide, which demonstrates what happens with Visipac. With Visipac, you have the majority of the erythrocytes, which maintain their original morphology and their shape, basically. And the impact on the capillary will lead to buckling of endothelial cells, as I mentioned, leading to narrowing of the free vascular lumen, and has a potential to impede the capillary blood flow. And in addition, damage to endothelial cells may result in their loss of function. And all this leads to capillary hypoxia. But this is not all. On top of all this, we have excipients in the contrast media products. And as the low osmolars are already 2 to 3 times higher than blood's osmolality, they don't have the luxury of manipulating the electrolytes. On the other hand, iodixanol is hypoosmolar, and we have a chance to add in physiologically balanced electrolytes into our products. So these electrolytes, when they go through the various systems like the central nervous system or the cardiovascular system, they don't have an impact on the electrophysiological mechanisms that regulate our central nervous system and cardiac functions. That is why the tendency has been to lower chemotoxicity by removing carboxyl groups, lowering osmolality to counteract major fluid shifts, and to add balanced electrolytes to contrast media to help minimize the effects on cardiac contractile force and the fibrillatory propensity. Why are we doing all this? Because we know for a fact that once a damage is done to the kidneys after injection of contrast media, that is known as contrast-induced acute kidney injury, there is a disruption that leads to increased rates of death, bleeding, myocardial infarction, and other complications. On the graph, the green bar represents patients who haven't developed an AKI after injection. The purple is the graph that demonstrates patients who have developed acute kidney injury, and the light blue graph demonstrates the patients who suffered from chronic problems ending in dialysis. With these 3 complications, death, bleeding, and myocardial infarction, you see that patients who have ended up having acute kidney injury and had to have dialysis have higher problems throughout the years. This is a meta-analysis demonstrating the difference in the usage of low osmolars and isoosmolar contrast media in the interventional radiology setting. So intraarterial use of Visipac reduced the risk of contrast-induced acute kidney injury by 54%. In simpler terms, in intraarterial injections, if you choose Visipac over low osmolar contrast media, you have removed at least half of the acute kidney injury complications. This is from the McCullough meta-analysis published in 2011. But this is not the only evidence. We also have another meta-analysis published in Seoul, Korea by Dong and Associates, which give us pretty much the same thing. In the intraarterial setting, by choosing Visipac, iodixanol, over low osmolar products, you are able to achieve a significant reduction in the contrast-induced acute kidney injury complications. So this means you have better outcomes, less complications that you have to deal with, and that will make more sense in the following slides. And cardiac events. As I mentioned, the fluid shifts lead to dehydration of red blood cells, and increase in circulating intravascular volume, and this leads to decrease in cardiac function. And another meta-analysis, this one from Zhang, shows that adverse cardiac events following intraarterial procedures are less likely with VisiPack over iopramide in this single meta-analysis. So all of these meta-analyses show that there's a marked advantage of using VisiPack over other low osmolar contrast media products. I will shift from the randomized trials to the real world evidence and show you what happens in real life, because we don't always operate in ideal conditions. So patient is much more comfortable with VisiPack, as you see in the past two graphs, but I'd like to show you what happens when you shift your practice from low osmolars to iso-osmolars. This is from the Premier database from the US, and this has been a data analysis of all the PCI procedures that they covered for a period of almost 5 years. And this data mining practice has showed that not only you are able to reduce individual risks like events requiring dialysis, acute myocardial infarction, angina. I'd like to thank you all for your attention. I have been disrupted a bit abruptly by the dysfunction of my microphone. If you have any further questions, my colleagues from Alcan Company can provide answers. Thank you very much.